We're going to release the edges of the rectus abdominis muscle. It's a really important area to release, especially if you have any back pain, because the edges of the rectus abdominis, well, let's talk about rectus abdominis first. It goes from the lower ribs through the center of the belly in two sections and attaches down at the pubic bone. And this muscle draws the ribs towards the pubic bone. The edges of this muscle are thick lines of connective tissue, and it's connective, it binds. That's the nature of connective tissue, is to bind. And then these edges form the attachment sites of the obliques and the transverse abdominis, these other muscles on the sides. These edges tend to get tacked down if you have ever slouched in your life, or drive a car where you're drawn down like this. Those edges of those muscles get tacked down, which then will create a constant pull on the chest and create some dysfunction in the back muscles. So I've also found that releasing the edges of rectus abdominis can have a beneficial effect on any digestive issues that you might be having. So using the ball, I like to use a softer ball in the edges of rectus abdominis because your organs, intestines, viscera are all filling the belly. You want to be gentle in this area. It's a sensitive place. So we're going to start with the ball down low toward the pelvis. We're going to take that ball right in the lower section of the pelvis, but not right in the middle. We're going to be out to the side a little bit, and then we're going to roll up and down, releasing the edges on either side of the rectus abdominis. And that's going to allow the breath to be bigger, digestion to be easier, and ease a tensional pull on the back muscles. So lying on the floor, releasing the rectus abdominis edges, I'm going to start releasing my right side. So I'm going to bend my left knee out to the side just to give me a way to push off my body and allows me to tilt slightly toward the right side. Then I'm going to take the ball and put it right in my lower pelvis. Again, not in the middle, but a little bit off to the side. And I'm going to start sinking down into the rectus abdominis. And I'm going to kind of rock a little side to side. Maybe roll a little up and back. I keep my breath in my belly, breathing. And I just keep making my way up along that line, that edge, that thick connective tissue band that we're releasing on the edge of rectus abdominis, and that those other abdominal muscles attach into. If it's a little too much pressure, you can just kind of ease up, push into your arms and lift off. You can also lower your body down onto the floor more and sink down into the ball, and that's going to sink more of your body weight down. And you can just kind of rock side to side as you hold in a little deeper. And then I usually do 3 sections when I'm working through the rectus abdominis. And I'm going to bump right up to the ribs. And I'm just a couple inches over from my belly button and up a little right at the edge of the ribs. You can also pin and stretch a little here by sinking down and then lifting up into a little back bend and then sinking down. Lifting up into a little back bend. And one more time. And then you might even go all the way across. You can go gently through the middle. Maybe just rocking through the middle. I put a little more pressure in my elbows. And then I start to move to the other side. Coming down low in the pelvis again. and work my way up through the other side, that other line of rectus abdominis. And then I like to complete the process just doing a little back bend, placing my elbows on the floor, my hands, and anchoring my pelvic bone, my pubic bone down, and lifting up. And I also really enjoy then rolling onto my back and just doing some deep breathing in my belly. So I'm going to do that. I'm going to roll onto my back. And breathe deeply in my belly. And that's a nice way also to work in between both sides. So you might work just through the right side like I did. Breathe deeply in the belly on the back. And then shift to release the left side. Do a little back bend. Breathe deeply as you're lying on your back. And again, that is going to release a lot of pull and tension in the back of your body.